too. You can't just.
You don't have a lot of room, when you're sitting here. And just imagine the bigger guys. It's okay.
Gary! I was just looking for the sports channel, Gary.
What's up, everybody? Welcome to Two Transit Misfits. And tonight's going to be a very special show. We have two very special guests, two doctors that are going to join us tonight to talk about COVID and all the issues and crap that comes with it. I really hope you guys share this out to everybody. Hope everybody brings other people in to watch this. And I hope you got your questions ready because they will join us for Q&A. So let's not waste any more time and let's get the party started, right? Let's go. Okay, guys, it's Two Transit Misfits. I am your boy Blunt. And tonight joining me, we have Dr. Tandon and Dr. Fagan. I hope I'm saying that right, Fagan. These guys, let me bring them in. What's up, gentlemen?
Hey.
Welcome to the show. I have some questions and stuff, but before we get into that, right, let's go into you guys, because some people are probably going to go, who are these guys? Why should we listen to them, right? So here we go. Dr. Tandon, let's pull your accolades up, right? You let me know if I missed anything. You're an assistant professor of the Department of Surgery at NYU, from Grossman School of Medicine, assistant director of surgery at Bellevue, director of surgical quality at Bellevue, director of surgical intensive care unit Bellevue Center. You graduated MD from Jefferson Medical College. You did your fellowship and residency at University of Maryland Trauma Shock Center Surgical General Care Fellowship. Ooh, that's a mouthful. And your residency also at Robert Wood Johnson University Hospital General Residency. Did I miss anything there, buddy?
No. Just one of the surgeons over at Bellevue, and had the pleasure of meeting you during my time there, which is one of the best things about Bellevue. And I do want to say that I'm sorry that Brooklyn Pete wasn't able to be with us today. Yeah,
me too. Yeah, guys, sorry, Brooklyn Pete wasn't able to join us due to some conflict of his doing. But let's go. Dr. Ian, let's bring up your accolades also. We can't just leave it at that. You're an assistant professor at the Department of Medicine at NYU Grossman School of Medicine. You're also an assistant medical director, general internal medicine, inpatient services at Bellevue. You're also from an MD. You got an MD from New York University. So
Yes,
I would
sir.
say that. Well, first, did I miss anything? Is there something you want to add?
I mean, that's pretty good. You know, for me, the biggest part of my professional identity is working at Bellevue, you know, taking care of New York City. And especially this last year, really feeling like, you know, putting my heart and soul into caring for the residents of New York and everything that we went through. You know, it's been a hard year, and March and April were probably the hardest years of my life and my career, or hardest months of my career. And so I'm happy to be here and to share, you know, with everyone kind of some of our experiences.
Right. So, speaking of experience, I know from personal experience from being my vacation there at Bellevue, that you guys were extremely busy, and that was pre-COVID. So, I mean, how much has it changed since COVID started, as far as your scheduling and stuff?
I mean, so I'm just in surgery, right? So Ian is much more in the thick of all the COVID stuff than I am. But I want to speak towards what my experience was, only because I was getting a haircut the other day, and the barber, the 75-year-old gentleman, and he says, like, yeah, I'm not sure it's really that bad. Like, I've made it through, and like, how bad is COVID? It's really just a flu. So it was when things started. Bellevue made a very early decision before most of the other hospitals in the city to actually shut down all of elective surgery. You have to realize elective surgery is the financial bloodline for the hospital, and they shut it down because what they saw coming was so bad that we needed every resource we could get. We went from having essentially 50 ICU beds to having about 110 ICU beds. We converted everything, and we were ready to build another 50 in the ORs and just shut down the ORs entirely and turn every single anesthesia machine into an ICU if necessary. I think Cornell actually had to do that. It was beyond belief for how many people came in, how rapidly they came in, how sick they came in. There was another thing I heard on NPR the other day where somebody was being interviewed and said, you know, all this stuff about hospitals being overwhelmed. No hospital got overwhelmed. No hospital, you know, it was just simply they couldn't distribute the patients fast enough. And I was in disbelief when I heard that. I was like, I wish he had actually been there on the ground seeing it. Everybody was overwhelmed. You had, you know, so many people doing areas of helping in areas which they weren't routinely part of. You had ophthalmologists helping with dialysis bags. You had, you know, surgeons helping in the ICU, which would normally run by the medical guys. And we were constantly trying to figure out, where do we get the next ventilator from? Where do we get the next dialysis setup from? And as much as there's a lot of division in the country, I give so much credit to the rest of the country to really coming to our aid and really saving us, because at the point that we were at our worst, that we were about to get totally demolished, and this is Bellevue, which was sort of like the starship, you know, like we had the ability to get the sickest patients in, but we were still under much more control than so many other hospitals like Elmhurst and Queen and stuff. So we had things relatively under control, and yet we were about to be completely overwhelmed. And then we got this massive infusion of help from around the country, from nurses, respiratory therapists, physicians. It made all the tremendous difference. And that, all I can say, you know, is, you know, for anybody from other parts of the country who may be listening, is thank you so much to the rest of the U.S. for coming to our aid. I can't even imagine what it would have been like if that had not happened.
I didn't even hear anything about that. Other people coming into New York for help. I didn't hear anything about that.
It was gigantic.
But I heard plenty of the rumors that the hospitals are not crowded and it's all fake news. I heard plenty of that. You know,
it was a war zone. That's the best analogy I could make. And it felt like once it started, we were sprinting the whole time to try to keep up. I remember the first week when the world ended, March 12th, 13th, and I remember at the end of the week we had 5 COVID patients, and we were trying to figure out where this would go. And then the end of the next week we had 50, and the end of the next week we had 200, and by the first week in April we had 400 at one time in our hospital. And to give you just like a frame of reference, so the usual medicine service has 200 patients at most, all kinds of medical illnesses. And then the ICU has 12 to 15. And at our peak, our ICU, as Dr. Tandon said, had 110 to 120. And the floors had 300. So we were above 400 patients. And the interesting thing is that 90% of those patients had COVID. And so all of the other patients, patients having strokes, patients having heart attacks, they weren't there. And we were all wondering about that. But people were so afraid to come to the hospital. And I don't blame them, because people that work there were afraid to go to the hospital every day. But if those people were there, it would have been even more catastrophic. And I feel so proud of what we did. I feel like the patients got the best care they could have gotten. But it was because every single person there, plus all the people that came in, were sprinting the entire time. I worked 36 days straight, 10 to 12-hour days at one point. Jesus. And that's how it was. That's how it was.
And so, again, he said, like I was saying, like we typically have 50 beds, right? So about 10 to 15 of them are medical beds. The others are the neurosurgical, the surgical, the cardiac, so other areas. And all those things got shut down. Because the city closed down, we stopped having traumas come in. And even the traumas which did come in, we had very few, but the ones which did come in, about 40 to 50% of them ended up actually having COVID at that time. So we had to be as cautious in that area as anywhere else. It was insane how, I was impressed at, for me, it said so much about the teamwork of Bellevue in that there was like daily phone calls. There was a daily phone call across all of the hospital leadership of every single department. There was a daily phone call across all the ICUs of the health and hospital system. So everybody knew what was going on, where you had to help everybody else, who had to pitch in. On the construction side, offices were being turned back. They used to be old patient rooms, and they had been converted into offices. They were being converted back into patient rooms. Areas which were regular rooms were being converted to ICUs. Endoscopy suites were being converted to ICUs. It was, like I said, constant plans in terms of how do we convert the ORs into ICUs if we need to. So there's all this construction going on, all this constant discussion and work to try and stay a little bit ahead of it, barely staying ahead of it. And in the meantime, you had Dr. Fagan and all the other medical folks who were in the trenches actually doing the hard work. Myself and the other surgeons only got pulled in like the second to third week of April when it was really overwhelming. But from day one, he and the others were working so many hours.
How do you guys have you ever encountered or dealt with a patient who just could not come to the realization that COVID was real and was infected? Have you ever ran into a situation like that?
Yeah, absolutely. And it was shocking to me, because for us, like for me, at least I remember one in the beginning of April. And for me, this was my reality for the last 3 weeks was everyone was coming in with COVID. And, people were dying at such an alarming rate. We lost 225 people in our hospital alone in the first 7 weeks.
Right.
And
Jesus.
Yeah. And to have someone come in and their oxygen levels were low and they were short of breath and they needed to be admitted to the hospital, and for them to say COVID isn't real was completely mind-blowing to me. And, for me, on one hand, someone could get easily very frustrated with that, especially with all the emotional energy that was being poured into all of this work. But that wasn't my approach at all. My approach was, all right, you need help, and I'm going to give you all the help that you need, whether or not you believe that this is COVID or not. And that was my approach with anyone who kind of didn't believe. And most people that I interacted with, a few days in, were like, oh, okay, this is COVID.
And I know from experience that you guys have to deal with a lot of people who kind of resistance to you guys help. Me being one of them, I was a handful when I was there, but I could tell you guys right now that I 100% greatly appreciate the efforts that you guys put into my care and to making sure that I'm able to do this with you guys now live. For those some people may not even know this, but one of the reasons I have these two guys on here, one is because Dr. Tandon took care of me when I had my accident, and he put me back together. And we actually have a picture. This is me when I visited him, I think last year, was it? This was pre-COVID. I was going for my final surgery, pre-op test and all that stuff, whatever. But the atmosphere in Bellevue is just way different than any other atmosphere in a lot of other hospitals, where Tandon would come to my room almost on a daily basis, as much as he could, just to talk to me, to see how I was doing, and just sit down, not even talk about medical issues, just talk to me as a human being. And a lot of people in that hospital, Killer Ian, that's how they treat these people. They treat them like people. You're not just a patient to them. And so that's why our friendship between me and Tandon and now with Ian is the way it is. You don't get that with doctors. You really don't. That's very rare. So that's one of the reasons why they're here. And it's a testament that they're here talking to you guys about this anyway. Right. So let's get into some of these questions. People starting to ask questions, but let's start with the fear of COVID. The fact that people are so afraid that it was made in a year. So the consensus is that, well, they can't even cure cancer yet, or the flu, but yet they came out with the COVID vaccine in 1 year. What would you guys say to somebody like that?
Well, I think for me, the first thing I would say is, the science, it was so important to these scientists and to the world that this was created quickly because of how serious the illness is. And so, yeah, it's really fast. It's faster than most other vaccines have ever been made. But the technology has advanced to the point where they could do it. And I think there was such a need because, as everyone knows, this has completely upended everyone's lives. As hard as it was for us in the hospital those first few months, it has been hard for every single person across the world, hands down. Everyone has their own story and their own experience, but not being able to see your grandparents, grandparents aren't able to see their newborn grandkids. These things take a toll on people, and I think everyone realized that we need something to get us back to normal, and the vaccine is the only way. And I think that a lot of people recognize that and worked fast to make it happen.
Yeah, I sort of think about it as when you hear about somebody who has been working on their career for 20 years and then it's labeled an overnight success. It's like, okay, we got to know about them overnight, but they've been working at it for a long time. And so a lot of the processes which allow this vaccine to get developed a lot faster have been in the works.
Right.
I think I feel very fortunate that this isn't something like HIV. Like, people have worked really hard on getting a vaccine for HIV, but different viruses behave differently, right? They mutate at different rates. And so HIV keeps changing much faster than we can make a vaccine. The influenza vaccine is, we're always a year behind in terms of the vaccine that we get out for influenza. And so it's never that great. Here, people were looking at it. Everybody essentially was looking at it. All labs stopped except for looking at this. And they said, what can we target? And what was interesting was that you had different companies who end up using very much the same approach, because they all looked at it and said, here, this looks like our best target. There's a spike protein, which is what it uses to latch on. And that seems to be pretty consistent on this virus, and that's what we can try and target. So that and then you had each company trying a different approach in terms of how they could target that spike protein.
So from what I'm understanding, that they had started this back when we had the SARS, that they've been working on a vaccine from that, and being that this is just a variant of that, that's what gave them that little bit extra time to work on. So it looks like it's a year, but it's really been 10 years that they've been working on this in actuality. We got some.
Even the mRNA technology they've been working on for a while, and they've been trying to figure out like how do they utilize it, which is going to be the right disease to utilize, and this turned out to be that.
I got a question here. I'm gonna post it on the screen from one of our misfits here. It says, "Is the Moderna and the Pfizer vaccine approved by the FDA?"
So the answer to that is yes. It's approved under what's called an emergency use authorization. And so what that means is that, in emergency times, they can do a more kind of rapid approval process. Usually, these approvals could get marred down in a lot of bureaucracy and red tape, and it could take years for them to approve something. Whereas if it's an emergency, then they basically get all the people that need to be there to approve it kind of all in line to review and discuss, and they do a much more rapid approach. So yes, it is approved. And I do want to make a comment about the FDA approval. I think that is really important. With certain medications, like for example, like chemotherapy, right, for cancer, there's a lot of side effects, very dangerous. It's toxic to the body. But the patients are very sick, and this is the thing that's going to keep them alive, and so they accept a degree of side effects and toxicity. When you have vaccines, you're giving these to healthy people, right? Healthy people who have no problem initially to prevent a problem in the future. And so when that's the case, the FDA actually scrutinizes a lot more. Side effects are not tolerated at all. Obviously, there's some side effects for the first 24 hours. You could feel sick, your arm could hurt, but any long-term problems, any problems that could lead to death, anything like that would be a no-go. Even one person dying from a vaccine would make it so that they would not approve it.
It's very,
that
very
would not
strict.
be acceptable.
Right,
Yeah, very strict.
What I've heard is that the number of people who've been in these trials is much larger than the vaccine approvals in the past. Ian, you can probably speak to that more, but it's like people like, well, it was rushed through, etc. There were so many people who were at risk that and they got so many people to volunteer that even though there were multiple vaccines, each of them, the numbers in each trial are like quite large. And then on top of that, we've actually got the experience of millions of people who've been vaccinated since then to see how they're doing.
You brought me to a question that I'm pretty sure everybody's going to want to know. Have you guys been vaccinated?
Of course. Of course. Bellevue wouldn't like to hear this, but I like even cut the line by 1 day. They approved it for, they were giving it in sections. And so the first people were the people that worked in the ICU, and I worked on the floor. And when they said that the ICU docs could get it, I was like, I'm just going to get it. Because I want this so bad. I got it December 18th, which was the Thursday of the first week that the Pfizer vaccine was available, because I was like, I need this. At that point, I was on the medical floors. I had 4 COVID patients that I was caring for like that day that I got the vaccine. And I was like, every day I put my life at risk.
Right.
And I need this protection for myself and my family.
So I actually delayed a little bit because I'm surgery. So I'm not in the front lines for the COVID patients unless the numbers increase. So I'll be in the ICU when the numbers, if the numbers go back up, but I'm not seeing them regularly. And I wanted other people to get a chance. Frankly, my disappointment is I really wanted those who have the highest risk of dying to get the vaccine even before healthcare workers. And like people my parents' age, right? If they, I so wanted them to be approved. And the government decided it's going to be healthcare workers. And if I could have had the opportunity to change places with somebody in their 70s or 80s and let them get the vaccine before me, I would have done that, because I know that I can stay safe with lots of precautions. It's not perfect, but we maintain precautions all the time as we're dealing with these patients. And I'm not seeing them every single day. I have to make the assumption that any patient I see could have COVID, but I'm not seeing every single patient. And at home, we pretty much stay to ourselves. So we've got our small bubble. And I'm not in that highest risk for dying. It doesn't mean that somebody at my age and 20 years younger, we didn't see them die. But there were so many patients who were at much higher risk, and I really wanted them to get the vaccine first. But once it was clear that that wasn't really going to be the choice, like that, it's not like I could exchange it with somebody. Then after the folks in the NICU and the medical floors and the emergency room were getting the vaccines, then in surgery we signed up to get our vaccines. But we were encouraged from nursing, respiratory therapists, physicians, the folks, handing out the masks and being exposed all the time, the unit clerks, everybody's exposed. And I think, we've definitely encouraged people, when you have the opportunity, please get the vaccine. We don't want you getting sick. We don't want anybody spreading it to other people either. That everybody knows there's that period in which you don't know you're sick, and you don't know that you're spreading the vaccine because you haven't had symptoms yet.
Right. So that brings me to this question here that we got asked to from Pramila. So why are people who got both of the shots still wearing masks? Shouldn't they be safe from COVID now?
So this is actually a really important point, probably the most important point of all of this when talking about the vaccine, right? So you talk about Pfizer had a 95% efficacy. Moderna was 94. Johnson & Johnson was lower. It was 72.
Yeah,
67. Yeah. And then well, there was different studies when they combined a bunch of different places. It came out to 67. The initial was 72. But the point was that, these vaccines don't necessarily prevent COVID, right? What they do is they prevent hospitalization and death. They make it so even if you get COVID, right, you're exposed to it, and maybe you develop an illness to it because the immune response that you generated from the vaccine was not strong enough to make it that your body fought it off completely. But it was strong enough that when you did get a mild illness, then it was able to cut it off then before it got worse. And so in all three of the studies, even though in all of them, patients still got COVID, nobody went to the hospital and nobody died, okay? So for me, I'm vaccinated, but I still could be a carrier at some point and give it to someone who's not vaccinated. So I'm gonna wear a mask until everyone is vaccinated. And I don't want to be in a space with somebody that's not wearing a mask and me not wearing a mask if they're not vaccinated and I am, because I don't want it on me that I potentially gave it to them. So think of it as we're not eliminating COVID, we're turning it into a cold. We're turning it into a mild illness that doesn't cause death. And that's the point of this.
Great.
I mean, I think a lot of times when, we have definitely had, hospital employees who have a lot of hesitancy about it. And I think one of the things which we talk about is it isn't that you're just doing it for yourself. You're doing it as much for your family, both from wearing the protection. So, being really strict about the protection, making sure you're wearing face masks, making sure you're wearing the N95s, when you're interacting with people. I've got a 17-year-old daughter. And what we know about teenagers getting COVID is the older teenagers, they don't typically get symptoms, but they're at risk, much higher risk for the long term, that long COVID, the inflammatory syndrome. And it's like, I would pay myself, if I wasn't protecting myself and I, be nonchalant at the hospital, I get it. I'm fine because I'm vaccinated. My wife is a physician. She's fine because she's vaccinated. And our daughter ends up getting, and she has really long-term health consequences. Same way, don't want to take it to my parents, don't want to take it to other people. When I meet my parents are vaccinated, we're vaccinated, but when we meet them, we're all still wearing masks because, we have people in the family who aren't, and we need to still protect them. As much you need to protect the people at work. And I get that people are really tired of this. I do. In some ways, it's almost easier for us in healthcare because we're still going to work every day, right? Like that part of it, our socialization, other than the fact that everybody has a mask on and you don't really sit down to eat together, that socialization is still going on. You drive to work, your routine is still there, maybe different hours than usual, but it's still there. But again, like talking to friends and family members who aren't able to go to work, aren't able to do all the regular things, it's psychologically so hurtful, and I get that. I want to stop wearing masks just as much as anywhere else. I want to get back to where we can do normal things, eat indoors and not think twice about it, meet people on a regular basis. We're not there yet. And this isn't the point at which you just stop and say, I give up. I'm going to get rid of the mask. I'm going to get rid of the face mask or the goggles or whatever other protection. Like, we're not there yet. We'll get there. We will get there, but we're not there yet. So I implore, you, your listeners, to keep that protection on. By the same token, to get there, the vaccines are what's going to get there, right? And so for those who have been really, really cautious and staying at home and not interacting with other people and really missing that, well, the way it's going to get safer for that person to actually start doing those interactions is with the vaccine. That's what gets you safer to get out there. I still wouldn't stop the precautions in terms of the face mask and stuff, but you can feel a lot safer going out there because you're not going to get deathly sick if you do get COVID. And so just maintain the mask for now, get the vaccine, you'll feel a lot safer sort of meeting up with people, keep small bubbles still as much as you can until we get the numbers down further.
So I was just going
to say the other thing is the CDC just 2 weeks ago, they made guidelines that say that if you want to see family members with a group of less than 10 and every single person is vaccinated, then you don't need to wear a mask in that space. And so I think that should give people hope for the future, that if every person around you is vaccinated, then you won't need to wear a mask anymore and you'll be safe and everyone around you will be safe. You won't be hurting your friends and family.
Right. I mean,
really
it seems like common sense, but common is not that common, right?
Yeah.
You would think it would be. I'm telling you guys, this questions are coming in. It's going to be hard to get to every one of them, but we got one here from our parlor here. It says, on the CDC website, so far, COVID vaccines have killed 1,174 people. You have over a 3% chance to die of this vaccine and have a reaction. That is a greater risk than dying of COVID is most age, I guess supposed to be in most age groups. Is this population control? I think that's kind of a...
So I definitely want to take this. So as I said before, when we were talking about FDA and authorization, if COVID vaccine killed even one person, it would be taken away. It would not be allowed to be given. And that fact that a pseudo fact that your listener just shared is completely incorrect. There have been 0 deaths because of the COVID vaccine. And I promise you this, that if there was even one death from a COVID vaccine, I would not have been comfortable taking it. And it would not have been approved for me to get it. There's no deaths from the COVID vaccine.
I mean, so we've gotten questions, like, okay, why should we trust the medical system, right? Like, there is a sad history of discrimination in medicine, Tuskegee experiments and other things.
Exactly. Right.
There is a lot of inequity in people's access to healthcare, which has real long-term effects on their health. There's no question about it. I think, Ian and I both work at Bellevue because we believe in the mission that healthcare should be available for everybody. If this was something where it was targeting, hurting minorities, right? That was going to hurt the people getting the vaccine, and that's why we're trying to target, Black populations or Hispanic populations to increase their participation in the vaccines. Do you really think that rich white people would be going to figure out how they can be in the front of the line to get the vaccine?
I heard they've been even going to other states to get vaccinated where they're not supposed to be going.
They go to other states. They go. I mean, we have some really rich white people come to Bellevue who would never step in the door because they can get the vaccine there faster. It's like, wow, okay, all right.
That's crazy.
It's true. I mean, white people are by far taking the vaccine more than any other group, and so if anyone thinks that this is anything like, Tuskegee or other injustices that have occurred in the past to Black and brown communities, I just have to say, again, white people are taking it more than everyone else, and that should say something.
That should say something. We have a question from another misfit here named Star. Which vaccine do you recommend? I am waiting for the one-time Johnson & Johnson. Are all vaccines trustworthy, or is one better than the other? Which one do you recommend?
So I think that the point to note is that all three of the vaccines that are available in the United States, all three of them 100% prevented hospitalization and death. Okay? That's the one fact that matters most, right? All three of them did the job of keeping people alive, and that's what we want. Johnson & Johnson does have a lower efficacy rate than the others, meaning that more people that took the Johnson & Johnson ended up getting a mild case of COVID compared to the Pfizer or Moderna. But all prevented death. And so I think for people, my recommendation is the first vaccine that's available to you, you should take. In most cases, you sign up for a vaccine appointment not knowing which one you're going to get, and then you arrive there and you get it. And I think that should be the approach for people. If you're offered one, go get it. There's campaigns in New York City, for example, for people who are homebound, who can't get out, that there's these community-based organizations that are going door to door to people's homes, and they're giving them preferentially the Johnson & Johnson vaccine, since it's only one versus two. And there's certain other scenarios where I think, people maybe would benefit from just the one, as opposed to having to come back again for the second. And I think that would be maybe the only consideration. But with regards to which one is going to keep them alive, all three do the exact same job, and it's perfect.
Nice. So we also have one from Catherine here. It says, can you explain the difference between a rapid test and a PCR test?
Yeah. So first of all, the PCR test is a swab of the nose, and it detects the RNA of the virus. So it detects if there's any virus in your nose and there. And you can have a PCR test that's a rapid test, meaning that it comes back in a couple hours, or you can have a PCR test that's not a rapid test, that the lab takes maybe a day for the result to come back. There's the other thing that people might be receiving when they go to get a test is what's called a rapid antigen test. Okay, and so an antigen is something that the virus produces, like a protein. So one test, again, this antigen test is testing for something that the virus makes to show you that the virus is there. The other test is testing for the RNA, which is the virus itself, to tell you if it's there. They're fairly equivalent, but the antigen test can be done much more rapidly. So they can do like 15-minute tests for those. And the antigen test is a touch worse than the PCR test with regards to accuracy, but both fairly good.
I'm looking at it's kind of hard. This next question kind of brings me, because I had a question too, but this one kind of touches on it, and this is from Carlos Vera. Said, also, if the animals in the zoo, lions, were affected, what's the possibility of domestic straps, cats, or even squirrels getting affected? And the reason why it's more interesting to me, because I was going to ask you guys, because I heard that COVID-19 is a zoonotic. how do you say that? A
Zoonotic.
zoonotic disease. And what is a zoonotic disease? If you could touch on that.
Yeah, so the simplest way to explain this is that, viruses, don't just live in humans. They can live in kind of any type of animal, and different viruses, can take hold in certain kinds of animals and not in others. For example, like historically, the HIV virus was first actually came from a monkey in Africa, and then eventually made its way to humans in a way that it could infect humans. And many viruses are like this. Coronaviruses, in many cases, come from animals. And in this case, it is widely suspected, and what is understood currently is that it came from bats
Bats,
in
right.
China. And
Right.
so it first kind of originated in bats, and then made its way through the air to humans. And maybe with a mutation that made it more likely to infect a human than previously.
But there's no real scientific proof that it came from somebody eating a raw bat or something like that, right?
I don't know. Do you know anything about that?
I don't think you can say one way or the other. Unless you found patient 0, you wouldn't be able to figure out what it was. I mean, people ask about these mutation stuff all the time, right? Like, so the thing is, these are living organisms. They, they have short lifespans, so they keep, replicating. Replication isn't perfect, so you have errors in replication. That's a mutation. If that error in replication causes it to be weaker or less likely to survive, that error won't be duplicated in the future, and that mutation will die off. And if the error in replication ends up making it stronger or more likely to jump species or be more infectious, that makes it stronger, right? It makes it more alive. And that mutation is going to, stay on because that mutation strain is going to persist. So the fact that we didn't have COVID at one point, and then we've had coronaviruses for a long time. And viruses mutate. We know the flu vaccine mutates every year, and that's why we don't have a perfect vaccine for it. So just at one point, we were unlucky enough that it mutated in a way that it came over to humans, and in a way that, and it may have gone to some humans first where it wasn't strong enough to go from person to person. We've had those types of vaccine, those type of viruses, right? It goes from an animal to a person, but doesn't go from person to person. And that's a little dangerous, but it's not the most dangerous. But if it mutates in a way where it not only can go to the person, and then it can go from person to person, that's when it's dangerous. And if you get unlucky enough where it starts spreading before you have any symptoms, well, that's a really bad scenario. And that's unfortunately what this one is, right? Like, it starts spreading before you have symptoms, so you don't even know that you should be, cautious and isolating and stuff. Places which therefore isolated everybody before they had symptoms, to really shut down, and did lots of, testing and lots of looking at who their contacts were, from Taiwan and, Vietnam and New Zealand were much more successful at controlling it early on. We're way beyond that. We can't do that now. We want the testing so that we have an idea for how prevalent it is in each area of the country. We want the testing to figure out what the mutations are, what the strains are that we're seeing, to figure out if that strain is a more dangerous one, so that we can start paying attention. Well, okay, it's more dangerous. Is it killing more people? Is it affecting people who've had vaccinations? Those types of things. So far, it seems like that we're pretty protected. But I mean, one of the strains that's of concern is what's called a New York strain. Right? It was, I think, found in Williamsburg, somewhere in Brooklyn or Queens.
I wouldn't be surprised. We've been talking about Williamsburg for a while on the show right now. Williamsburg and some other spots in Brooklyn where certain ethnicities exist by themselves.
But the question was earlier, like, okay, can it go to animals, right? So can it go to dogs and cats? And we know that it's going to lions and stuff. It's not so much whether it can go over them. The question is, will it make them sick? And then will it jump back from them to people? And I don't believe that part has been seen, where it's jumping back from like a cat or a dog to a person.
That'd be some weird paradox we'll be stuck in, wouldn't it? If you get it, you pass it to your dog, you get rid of it, your dog gives it back to you, you pass it back. You be going back and forth. Oh man, that'd be crazy.
You know, there were some cases that of COVID, you know, affecting animals because they tested them randomly in zoos, etc. But you know, the reason why COVID is so bad and why we realize this is something major is because of how many people die when they have it. And you know, this year, so many people died. Over 500,000 people died from COVID. And so I think that if it was something that would be affecting animals, considering how many people have animals, and it was something that would kill them, then you would see animals dropping like flies, and we haven't seen that. And so I don't think that it's, like Dr. Tandon said, something that we really should worry about, you know, it infecting and killing our animals, if that's what the question was about.
Yeah, there's actually another one question. So she said, I'm a conspiracy theorist, doctors, but why aren't any animals dying? Birds or squirrels look fine. So I guess that would attest to what you were just saying.
Yeah.
And for those who don't really believe the numbers, I assume that everybody saw the pictures of the trucks.
The body, the boxes.
We have an area right before Bellevue, and there were, I think, 12 of the semi trucks, with coolers, where they were, putting patients there. It was taking a month or two, is my understanding, before families could, claim the bodies because of the whole process and stuff, which the Emmy was going through.
How many semis you said?
There was, like, I believe 12. And
12.
So the thing to note is that across the street from Bellevue on the corner of 30th and 1st is OCME, the Office of the Chief Medical Examiner. And so it wasn't just from Bellevue Hospital. It was actually all over the city that the bodies are sent there for autopsy and other things. And so that's kind of, they needed more space to handle all the bodies from the entire city, during the height of the surge in New York City initially. I believe there was something like 10 to 15,000 people that died in those first 2 months. And so I think that was in response to that.
Yeah, I mean, and that wasn't even the only spot where they had the trailers.
Yeah.
There were other areas in New York City which also had them. It was insane.
So, I think Paula, they answered this earlier because she says she read the CDC report that lists more than 1,000 that died from the vaccine since 2021. And she said these are from all age groups. The vaccine is still on testing mode. Why are they still giving these vaccines if they are killing healthy adults?
I think we answered that. Again, to reiterate, if people are just tuned in, there have been 0 people that have died from the COVID vaccine. 0.
Well, they got another one that says, why are they now enrolling children? I think they didn't do that in the beginning. Why was that?
So
like that?
I think, when you think about, wanting to make sure that something is safe, right? So when they do trials, part of that is making sure that things are safe. And I don't think people want children to be the first test subjects before they know whether or not it's safe. And so testing it with adults made more sense than testing it with children for many reasons. And, also mainly the people that are dying are people that are older and vulnerable. And children weren't dying from this, except for some kind of rare cases. And so it made sense for many reasons to shield children initially and test it in adults. And now that we know that it's safe in adults, they are going to be testing it in children. They just started with Moderna, and they're testing, of course, lower doses of it. And with the idea that children do not get sick from coronavirus, but children certainly carry it, and they pass it to the adults in their life, and that could eventually get sick and even die. And so to protect a 3-year-old's grandma and grandpa, the 3-year-old could be vaccinated so that they are less likely to carry COVID and give it to their grandparents.
So I see that, the one person has said, the CDC, that's about to comment on, that the CDC website did not lie. So perhaps we can do this, that afterwards, we'll take a look at the website, see exactly what she's speaking towards, and try and explain a little further. Like, I don't have the website open in front of me, and
I actually do
I'm
have
not,
the website open,
okay.
but on something else. I
So,
do have the website open.
yeah. Again, if we had that many, so just think about, like, just now, people are, like, a lot of places are no longer using AstraZeneca, not because people are dying from it, because there's a concern that they may be getting more blood clots from it, which is
Mm.
much, much more minor than dying. And so a lot of countries are saying, hey, should we still continue using this? Nobody is saying stop using Pfizer, Moderna, J&J. And if you had that many people dying, you would figure one country or another would say, hey, wait, this doesn't make sense. So that would have to be a conspiracy across all countries. And like, why would you make such a big deal about potential blood clots and not make an even bigger deal about people dying? So we can take a look at the website and see exactly what they're saying and what they're quoting and stuff, and respond to it later to your Facebook page, or some other means to answer some of the questions. But yeah, again, I wouldn't. It's to me, it intrinsically doesn't make sense. It's not consistent.
Here's another question: if I got vaccinated, how do I protect my child who can't get vaccinated yet?
Yeah, that's exactly my issue, right? So, I wish we were in Connecticut, because as of April 1st, 16 and older, I can get vaccinated. I said my daughter's 17. I'm not sure when it'll happen in New York. I hope by sometime in May or before she goes to college. But in the meantime, how I protect her is that anytime I'm outside the hospital, I have a mask. If I'm in the hospital, I've got my N95 and face shield with any interaction with people. And when she's out of the apartment, she's got a mask, and the people she interacts with a small group of folks, and they've got masks. So that's how you do the protection until this dies down. And I wish, for her sake, for everyone's sake, that this had died down already. It hasn't yet. And all I can say is, the sooner people get vaccinated, the more people wear masks in the meantime, the faster we shut this down.
Yeah, and just to add to this, so what we're looking at is, this concept of herd immunity, which I'm sure people have heard, which means that enough of us have antibodies or immune responses to COVID, whether it's from the vaccine or from having COVID previously. Enough of us have it where it's no longer going to be able to be spread between people. And so that, of course, includes children. And I think it's important that eventually, children will be vaccinated as well. And so if you look at, the estimations from the CDC, and there's also a great graph in the New York Times vaccination section, it shows the pace of current vaccination and when we'll get to this, herd immunity threshold, which different people believe different things. Some people think it's somewhere around 70%, 75% of the population. Others think it's more like 85% of the population is immunized. And so with regards to children, I think it's important that children are part of this and that children are vaccinated, because although children don't get sick usually, they can, and they certainly can spread it to adults. And so the goal here, and from what I've read about the Moderna trials, is that they're hoping to study this in the next 2 months, release the data so that the FDA can approve it for children, and then start the vaccination campaign for kids over the summer. And so when we're getting close to that herd immunity, which is now kind of expected to be, if we continue this pace and everyone gets vaccinated, somewhere in July and August, that the children will be getting vaccinated, towards the end of the pack, but they'll be kind of included in this herd immunity, and they'll be kind of, everyone will be safe together. And that's going to be the point, like Dr. Tandon's mentioning, where we can all take off our masks and we can all feel safe. But it really can't do that until we're all vaccinated, and that does include kids.
Right. We got to know, what is the life. This is actually pretty important, because some people feel like the vaccine is, one and done or two and you're done. And what do you know about the lifespan of the vaccine?
Or I think what they're asking is, if you get the vaccine, how long are you protected from COVID? And unfortunately, we don't know yet, because a lot of the data was looking at the prevention of COVID in the first 2 to 3 months after the vaccine was given. and they weren't really looking longer because they were ending the study so that they could get it out. But now they're studying it, for longer periods, and so now we know that it does give people protection for 6 months. And again, as time goes on, we'll have a better sense of how long this protection will last. With these variants, et cetera, there's a lot of concern that we might need, yearly boosters, similar to like a yearly flu shot, that might have, some protection from different strains. So that way, we maintain this immunity. But no one knows for sure if it's going to last a year or longer. Or maybe, we can achieve herd immunity, eradicate this illness, and then we won't need to vaccinate every year. And so there's a lot of ifs. But I think, again, everything's so new that only time will tell. But the Pfizer and Moderna trials were happening in August and September of last year. And so if you can imagine, those patients are now 7 months out from receiving their vaccination. And so as time goes on, we'll know more.
That actually brings it's kind of like a good rollout to this question. The P1 variant, commonly known as the Brazilian variant, has just been reported in Connecticut. How effective are the current authorized vaccines in preventing serious illnesses from this variant? That's a good question.
It's a fantastic question. I can share what I know, which is that the Pfizer vaccine and the Moderna vaccine were not studied with any patients who had these variants, right? They were studied mostly in America and other kind of white, if you will, countries. And they, at that time, early on in COVID's life, there weren't many variants. And that is probably why the numbers were so good, the 94 and 95% efficacy. Johnson & Johnson was studied in South Africa, which has a very similar variant to Brazil. And they found that the efficacy was less, somewhere in the 45 to 50% range, which is still decreasing the virus. But what it did do was decrease serious illness and hospitalization to 0. And so when you look at the Johnson & Johnson data, it was very successful. Again, 100% prevention of hospitalization and death. And then the other vaccine, which people have been talking about that we don't have in America yet, is the AstraZeneca. And they actually studied that one in South Africa, and it was not successful, had a 22% efficacy. And so they actually had to stop the study because they realized early on that it didn't work. The Brazil variant is similar to the South Africa variants. That's why I keep mentioning that. And we have more data from the South Africa than Brazil. So what it says is that every vaccine is going to be different. We know Johnson & Johnson works against it. We don't know about Pfizer and Moderna, but experts suspect that they will be effective. Again, not 94 or 95% effective, but 100% reduction in hospitalization and death, but to be determined. And I think more studies are happening now with those vaccines, looking at whether or not they're effective against these other variants, which I think is important work.
Mm-hmm. So I think you kind of touched on this. Do you have to keep taking booster shots?
It's not clear that's going to be so much of a booster shot as much as a modification of the vaccine. So like polio, hasn't changed its form in years. So you get one shot and that covers you for your life. Versus influenza is constantly modifying. And so each year's vaccine is a little different from the prior years. We don't know how fast this is going to mutate and how much those mutations are going to be resistant to our current vaccines. If something comes out and really changes the spike protein, which is what most things have been targeting, that's going to be a big deal. Right? When they were studying these, they thought this was the most stable area, and that's why they targeted the spike protein. But if we get a variant which is very, really changes the spike protein, it may be that it actually makes it ineffective and the vaccine and the virus is no good and the virus dies, or it may be that it's actually much more variable. We don't; those are the parts which we can't answer, and so we are trying to be, very honest with your viewers, and telling you the parts that we don't know. But the best information so far is that with the variants we have so far, it is successful. The New York variant, as it's being called, is a little more concerning. We have to watch and see how successful it'll be for that one. But the other variants, the vaccines we have so far are quite good at it. So will somebody require updated vaccines? Maybe.
Most, like, who knows? I mean, it's still fairly new to everybody, right?
Yeah.
I mean, it's still working hard at it. So we don't have solid answers right now. It's a difficult position to be in.
One person said, so it's still in a trial period.
Right.
And I mean, so life is unknown, right? You can look at not doing the vaccine and continuing on and saying, well, one, are we happy with just continuing on the way we are? And two, well, life is a trial period, right? We actually don't know exactly what's going to happen. So what we're doing is everybody's trying to sort of look at it and say, with all information out there, what makes the most sense? And there's a lot of evidence that the vaccine will allow people to get back to what we want as more normal life a lot sooner than otherwise. Again, if early on we had gone to isolation and testing aggressively, maybe we could have been like New Zealand or somewhere, but we're not, right? We didn't get there. And so now we have to deal with the fallout from that, which is then, using the vaccine as the next step to try to protect us.
So you got this this question. The information about the virus and the vaccines differ depending on country and state. I'm following several sources and I'm hearing different things from all sides. Yeah, I can imagine. The misinformation that's out there is incredible. This is one of the reasons why we're doing this tonight. This is one of the reasons why they're joining us tonight, is to try to get as much truth as they can. And these are two doctors who are on the front lines dealing with it at one of New York's most famous and most rapid hospitals, Bellevue. So, I mean, you take it as you want to take it, you guys. You already know how I feel about that. It was another one that I wanted. It was really a really good check. Let's look at this question here. If a nursing mother receives the vaccine, can she pass along antibodies to her breastfed infant, and would this provide any level of protection to the child?
So I wish I had a great answer for this, but I don't. But I'll tell you what I do know. So pregnant women and women who had newborns were not necessarily included in the study. Certainly not pregnant women. However, the American College of Obstetrics and Gynecology, these experts in the field made recommendations that pregnant women and women who recently had babies would be safe to get the vaccine, and it would be safe for their babies if they breastfed. Does that mean that they pass antibodies to them? I'm not sure. They certainly do for other things. They pass antibodies for other things through their breast milk. So I can imagine that they might, but I don't think anyone knows for sure, because I don't know that that's been studied, or if it has been studied, I'm not privy to the information. But I think it's a great question, and I think for any woman who is pregnant or has recently had a baby, I want to encourage them to get the vaccine, that it's safe for both them and their child.
I had a friend who we was having a discussion, and she was telling me how one of her family members got pregnant during COVID and ended up losing the baby because of COVID. But the mother, I think the mother being didn't catch it. So could it be possible that the child absorbed the COVID from passing it on to the mother?
I mean, more likely she was asymptomatic, right? We know not everybody who gets COVID will actually have symptoms. So more likely she was asymptomatic. It's unlikely that it passed, that it somehow went through the air into her airways and into the womb without having infected her. But again, she could have been asymptomatic the whole time. We can see if there is any data out there in terms of if anybody's looked at in terms of antibodies to the child. I'm not familiar with it, but again, we can add this on if we can find something on that. However, I know that there has been some stuff about are pregnant women at more risk when they do have COVID, and I believe, Ian, correct me on that one, but I believe that actually been a lot of reports of pregnant women actually having very severe disease around the time of delivery, and thought that they actually may be a higher risk of having more severe COVID.
Yes, and so what we found out early on was that people with a weakened immune system are more likely to have severe disease. I think that's pretty straightforward and logical. And women who are pregnant are considered to have a weaker immune system. They're basically, their own immune system is taking care of two people instead of one, if you can think of it like that. And so those women are at increased risk for having severe disease if they were to acquire COVID. And so extra precautions should definitely be taken for any woman who's pregnant, wearing a mask, again, getting the vaccine so that they can prevent the potential for severe disease if they were exposed.
Right, so that leads me to a personal question that I have, because my misfits, they already know how I feel about it. I've been saying that I'm not taking a vaccine because I feel, one, it was just too new, and I wanted to see what the test results would be like, basically, and two, I have so many underlying conditions due to my accident that I was scared to inject something foreign into my body, and then after surviving everything I've been to, for me to go out voluntarily is just weird. Like, I'm not doing that, So, in my case, with all the stuff that's going on with me, what would be your advice as far as getting the vaccine? Should I wait? Should I take it now, or what?
My advice is take it now. Go online. There's a website. We can post it after for New York City, and of course, many of your listeners are all over the place, and there's different protocols for each city, each state. But for you, with underlying medical conditions in New York City, you're eligible. You can go on. I bet you can get an appointment for tomorrow or over the weekend. They have 24-hour vaccine hubs. For example, Yankee Stadium, you could go overnight. You can go tomorrow and get it. And I think for my advice for you would be, and for anyone, is when you're offered it, get it. Because it's going to save your life. If you get the vaccine, your likelihood of dying from COVID goes from something to nothing, right? And the likelihood of dying from the vaccine is 0, okay? And so when 550,000 people in this country have died from an illness and 0 have died from a vaccine, and the vaccine shows to prevent death in 100% of cases, it feels like a no-brainer. And I don't want to be preachy. I don't want people to feel like I'm telling them what to do and sitting on my throne. I mean, I got it myself the first day that it was a day before it was made available to me, because I wanted it that bad, because I knew that it was something that was going to keep myself and my family safe.
So I want to, so absolutely agree to get it. I think you have had to isolate in ways this year which are extremely hard. And I think you want to get back to where you can start socializing, even in small ways, and feeling safe about it. And I think that's what it's going to take. I think that's the way to take it. Now, one person had said, like, to please ask the question, which they'd asked earlier, that is there going to be a requirement for the vaccine? There's in the U.S., I don't think so. I think in other countries, they may get to the point of it. There may be businesses which may require it. But do I anticipate in the U.S. that we're going to get to the level in the current politics to say that people are going to say you absolutely 100% have to get the vaccine? No. Will it get to a point where overwhelmingly we will see people wanting to get it? I do think it'll get there. For the other person, who has mentioned about the CDC website and the number of people who died, again, we will. I need to look at the website. I need to look at what they're quoting to be able to comment on it. But let's take worst case scenario, right? And I don't think that's what this is. The worst case scenario, we have 1,000 people, 1,174, I think she wrote, who've died from the vaccine. In that same time period, you've had way more multiples of that continue to die from COVID, right? I think now the numbers are down to about 1,100 people a day dying of COVID. And for a while, we were about 3 times that amount. So worst case scenario, if that was the case, it is still so much less than the chance of dying from COVID. And I don't believe that's the case. And again, I can't reasonably answer her questions about it without looking at that site and what they're exactly claiming.
Right.
And then, but we will get back to your viewers.
That would have been a good question she could have sent me ahead of time, so I could have got to you guys before we got on the show. Right?
Is the COVID required for infants and children? Not yet. It hasn't been tested on them, so we're not anywhere close to the same. And we don't know in terms of the safety, right? So so that's what has to be looked at to say, when we've got more time on this to figure out where on a vaccination schedule for children, et cetera, would it be? Don't know. But it's like, hepatitis B, right? So years back, I got hepatitis B vaccine because I was in med school and residency because of that exposure. Now it's gotten to a point where we know that vaccine is so good. And even though on a general individual person may have a low risk of it, it's such a safe vaccine that it is now part of the vaccine regimen for kids as they're growing up. Thank goodness, because the amount of cirrhosis and cancers we saw from hepatitis B will hopefully continue to come down because we've got generations of people growing up who've been fully vaccinated. Where exactly this vaccine will be in that spectrum, it's way too early to tell.
You got one from Bernard here. Be nice. Big Bernard, what's going on, man? If everybody take the vaccine, if everybody take the vac, I should not have to because I'm healthy as I can be. It's a trick to make us get a shot. Don't wait. Don't want it don't want it after I hear a lot of people got sick for taking a shot.
Yeah,
we have nothing to gain by asking that individual to get the shot. If he was to ask us, should he get the shot? Can he get sick? Can he die even though he's healthy? And I'm guessing he looks fairly young, 50 or maybe 50 years old. Yeah, we saw people who are healthy, who are 30, 40, 50, who died. And they died without any family members there. And it was heartbreaking. It was like one room after the other, and they were all incredibly sick. And one person after the other, we were constantly trying to save their life. And, but it wasn't variable that you'd have a couple of deaths each night of people you couldn't save. And and you had a 70 or 80-year-old who made it out of the hospital. And you'd have this 30-year-old who died. And say, what is that all about?
It's not fair.
I'll let you sort of.
Well, I was just going to say, if everyone had the mentality that everyone else is going to get it, so I don't need to, then you're going to have a bunch of people that don't get it, and then not everyone is going to have it.
So we'll never reach herd immunity.
Yeah, we need to reach herd immunity. I mean, originally when they talked about masks, they said we need to wear masks to protect each other. And I don't know that people bought it so much because they kind of just wanted something that was going to protect themselves. This thing protects us and it protects each other. And I think that it's important for us to think about our friends, our family, our neighbors, our colleagues at work. Everyone wants to get back to normal life, and we really can't until we've gotten herd immunity, and everyone has to do their part.
The other thing I'll say, so the picture that Bernard had was looked like him, his wife, and his daughter. And so he's healthy, and so he gets COVID, but doesn't really have symptoms or has really mild symptoms. So he gets through it. And we know enough people who have made it through COVID, right? Not everybody who has COVID dies. Like, the majority of people don't. We've got a good number of people who never know they have symptoms. You have a good number who have mild disease, stay at home. You've got a good number who made it to the hospital and made it out alive. You've got a number where they died or they've been in the ICU for a long time and they're still really sick months later and their whole life has changed around. But he's one of the lucky ones, and he gets COVID, minimal to no symptoms. You don't know that's going to be the case if he infects his wife or his daughter or his parents or good friends. And so the vaccine isn't just about protecting yourself. It is protecting those around you. The mask at this time, even after you've gotten the vaccine, isn't to protect yourself. It is to protect those around you. I think we all have people we really, really care about and want to continue to see in our lives. And that's what the vaccine, the masks are all about. If you've had COVID before, do you still need the vaccine? I'll let Ian answer this.
Yeah, there's two questions. So the first one is, if you've had it in the past, do you need the vaccine? The answer here is you should get it, because if you think about, everyone's exposed to COVID and they get a different amount of the virus in their body, and their immune system makes a different amount of the antibodies and other cells to help you fight it. But with the vaccine, it's more controlled. And so we know exactly how robust the immune response is going to be with the vaccine. And so it offers you a level of protection that just having COVID maybe wouldn't do. Maybe just having COVID would be enough, but it's not known. And so most researchers and most experts feel that getting the vaccine, even if you've had it before, is the right thing to do. With regards to if you've recently had it, what should you do? The current guidelines state that if you've had COVID within the last 90 days, then you should not get the vaccine until after that point, for many reasons. I think, for one, in the first 90 days, you're the most protected from your natural immunity from getting COVID again. So let's share the vaccine with others who are maybe less protected at that time. And then also, because if you have more of your immune response already in place, when you get the vaccine, you're more likely to have some side effects. And by side effects, I mean one day of feeling lousy, or pain in your arm, not serious long-term illnesses, but, feeling like having a low-grade fever for one day. These types of things are more likely if you've had COVID more recently.
Well, I mean, it's a lot of questions going here. I want to show you a video. I want to show the guest the video. You guys seen the video, because it has a lot to do with this misinformation that's going around. And I think that's the majority of the reason why we have so many questions. It's just so much misinformation going around. And this is just one of them that contributes to it. Yeah. So, guys, pay attention to this.
People say it's not even a vaccination. It's a genetic experiment. What do you think?
Yeah, so doesn't really meet the criteria. But I suppose there are three waves of adverse events, right? There's the adverse events, which is more or less like anaphylaxis in the first week. Then these vaccines shouldn't be given in a second dose, So I know they're planned, a lot of them, for 2 vaccinations. But the real adverse events will happen, whatever the mRNA is in the vaccine, that when the person comes across that, it could be in February, March 2021, or in a year later, that would be when, in the animal studies, maybe 20%, 50%, or all of the animals died. So I'm also saying that people over 80 who get these, between the combination of the first adverse events, which is about 2.5% in some vaccines, 1 in 40 people, have adverse events where they are not able to function or work or live life normally. For the second vaccination, it could be 1 in 10. But for the over 80-year-olds or 75-year-olds, I would think that about 80% of them will have life-limiting adverse events or die when they come across the mRNA again.
Yeah. So the full video, guys, is up in Two Transit Misfits in our sister website, Next Plus, please, if you want to watch the full video. So what do you guys think about that?
It's so hard to watch, because I know that none of that is real and based in any kind of science. And I wonder what motivates people to say things like that. We have something that is life-saving, proven already to be life-saving, probably contributing in a big way to the decline in cases that we've been seeing recently, and will only continue to lead us out of this disaster that we've been dealing with, that's been life-changing for so many people. And what motivates someone to, share falsehoods that could persuade people to not take a life-saving vaccine? I just don't understand where that comes from and why someone would ever want to do that. And so that's my initial reaction, but it's frustrating and it's sad because, taking my doctor away just as a human, I want to get out of this. And misinformation like this confuses people, scares people who are already scared, and makes them question the decision that they might make, that experts and others are helping them to make regarding taking the vaccine. And so it's sad.
I mean, you can go through the scientific parts of it and explain why it doesn't make sense, but I suspect that it's much more of an emotional drive to make people want to believe something like that. If your listeners want, the scientific part of it, we can go into that later or now, whichever. It's just, it worries me. Yeah.
I know, Doc. I can imagine the frustration that you have because it takes something as simple as that to throw a monkey wrench in everything that you guys do. To take what you guys do and just make it look like it's not happening at all, and for you guys to be in a position you're in where you're watching people die left and right by themselves, and you putting 100% of your effort into saving their lives, and then for somebody to just sit home and do something like this, it's like you was asking me earlier, who is she? Who is she? Who's this person? And then she talks about animals. What test is this? Where's the information? Where's the resources? I need to see what. But other people are not like that. Other people will look at that and take that as the gospel truth. And so that's why I wanted you guys to look at that and see what your opinions would be about that. So along with that, we also have something that's been out there a while, and this one is a little bit harder to digest because it comes from the CDC itself, and it has to do with the zombie preparedness.
Yeah. Can I just make one comment before that?
Yeah,
because I've been through some of the comments, and reading about this is to trick people into getting it. Again, we there's nothing we're gaining by recommending people to get it. If we're going to be dead within a year because we got the vaccine, boy, we did something really stupid to ourselves, and encourage our families to get it.
Right, because
I am encouraging any of my family who's eligible to get it. My parents have got us, as soon as they were able to sign up. The computer systems were so crazy; it took a while, but and we were worried, until they were able to get it. As soon as my daughter's eligible, she'll be getting it. So I don't think I have an interest in killing off my entire family. I don't have an interest in killing off all my coworkers, and I don't have an interest in killing off all your viewers. We really do care about people in the city. So we're not going to be able to convince, if somebody really feels like we're out here to trick you, we're not. I don't know that there's any words we're going to be able to use to convince you otherwise.
I wanted to say, to add to that, we're not getting paid for this. We did this because we want to do this.
Oh yeah, I didn't mention that to you guys. Yeah, they're not. There's no check on the way.
Wait, this is like the Oprah interview where I get something.
I should have put that in the disclaimers, right?
We're doing this out of the goodness of our hearts because of how important we feel this is. That we help people to understand the truth, so they can make decisions that'll help them live longer and potentially not get COVID and die. And so, that's my only motivation in being here.
We're doing this because we care. It was so hard to hear the stories about, bus drivers and people in the subway conductors getting sick because they weren't getting enough protection, especially when the masks weren't being used as much, or passengers refusing to wear a mask and exposing people. Those are heartbreaking stories. Like, you still want that to happen to anybody, and so yeah, I mean, we're only talking because we really do care about all of you.
And so we're getting a lot of hearts here on the site here, and people are putting up thank yous and stuff like that. So you are being appreciated. I know I appreciate it. So I mean, I'm actually, after I finish with you guys tomorrow, I'm going to see if I could set up an appointment for mines.
Amazing.
I think I've made a decision on what I want to do with mine. I think the best point that you guys proved to me is it's better to have the vaccine than to have the actual virus, right? Because once I have the virus, it's up to God, right? If there's something I can do about it, then I'm going to do it now.
Listen, if I was going to say, if I came on here and I just convinced you, I would feel like this was a job well done and a success.
Trust me, I was really on the fence about it. I was like, not me. And but we got here for some doctors, all the only ones who I listen to, and thank you for shedding light and putting the rest of the crap that people are putting out. I appreciate all that you do on a daily basis. Stay safe, doctors.
That's very nice.
Another one from Bernard. Thank you guys for the info. But if the vaccine don't last for life, I don't want, there you go. I don't want discouragement.
I hope we can consider in the future.
Yeah. So, but he says, thank you guys. Another one from Idalia. Just want to thank you, Dr. Tandon. Thank you for seeing Ur Boi Blunt. Thank you for my recovery.
Mr. Garcia is the best.
I'm about to cry. But listen, guys.
We're going to do zombies.
Oh yeah, let's so let's end it with the zombie thing, right? Because that's one of the things that's really going off on social media, especially TikTok and Facebook and stuff, is that the CDC put out zombie preparedness thing, and it's actually on the site. Let me pull it up right here so you guys can see. This is live on the CDC site. I just wanted to make sure I didn't cut everybody off. This is actually live on. You see, I'm moving it with my mouse. This is live right now on the CDC site. Zombie preparedness. They actually have a guide to if the world was to be taken over by a zombie apocalypse. So there's truth that is on the site. It's very true that it's on the site, right? But people just fail to do the research. They take that and they run with it. They're tying this into COVID. They're saying that this whole COVID thing is a plot for depopulation, and one that we're a big test that they're trying to end the world. So this is actually on the site. But if you can read the lines right under this, the captions under this, it kind of explains this. It's wonder why zombie apocalypse, and zombie preparedness continue to live and walk dead on the CDC website. It says right here, as it turns out, what first begins as a tongue-in-cheek campaign to engage new audiences with preparedness messages has proven to be a very effective platform to continue to reach and engage a wide variety of audience on all hazard preparedness via zombie preparedness. But that's not what people are getting from this. That's not what's being pushed out there. It's about the vaccine, and people turn into zombies. Like you see, that lady said people die within a year after. So I guess we're turning into zombie now. So what is your take on something like this?
Well, I think the first thing is it says it right on the first page why they put that there. They put that there as a way to get people onto their site, right? A little catchy thing that'll get people kind of, oh, what's this zombie thing? They go to the CDC site and they start navigating around and they read about, various other preventative measures they can take to keep themselves healthy. And I think that was the goal here. And so the first takeaway for people is when you're given information, read it and try to understand it, and don't skip around because you might miss the message that it's trying to send.
Exactly.
So that's one. And then I think the other thing was just that I saw that this has been on the site for 10 years or more. And so if anyone thinks that this is from COVID or something that's going to happen to you from the vaccines, it can't be, because when this was created, COVID and the vaccines did not exist.
Right. From what I understand, it was created 2011 when they first tried it out, and it actually crashed the websites. What you call it? Things. The servers. Yeah, actually crashed the servers, and that's what prompted the director then to continue on with it every year, because of the attention and everybody coming to the website for it. So I don't know what to say about that. It's just crazy. Doc, any last words before we go? Because we actually over time.
So my request of your viewers is please consider again the vaccine when you're eligible, and please continue to wear a mask to protect yourselves, protect all those you love. And if you're in that group which is saying, I'm not ready to get the vaccine yet, please wear a mask.
Just wear a mask, right? Ian, any last words?
Yeah, I mean, Dr. Tandon kind of took, my final thoughts, but from a human level, let's get back to normal, and let's start getting back to, the life we used to have. And to do so, we need to eradicate this virus. We're not there yet, but we have an opportunity to get there. And to get there, we need to wear a mask until we achieve herd immunity. And we need to get vaccinated in order to get there. So my plea is to, think about not just yourself, but your community, and do what's right for everyone so that we can get out of this.
Exactly. I mean, like you were saying earlier, Doc, it's really for some people who are already decided. There's really nothing more you can say to convince them to wear a mask, to get the vaccine. But if you choose not to get the vaccine, just wear the mask, not just for yourself, but for everybody around you, the people you care about.
I'm not giving up on anybody, by the way.
Guys, if you don't know Dr. Tanner, he will not give up on you. If anything, he will be on you every day. I know. Trust me. So, guys, thank you for coming. Don't go nowhere. We're going to talk after the show. But I just want to end the show real quick. All right, guys? Guys, everybody say goodbye to these guys. Everybody's saying goodbye.
Thank you so much for having us on.
Thank you.
I
really appreciate you guys coming. This meant a lot to me, and I'm pretty sure it meant a lot to the Misfits. And I want to thank you on behalf of them for taking the time out of your busy schedules to share this information. And who knows, maybe later on down the line, you guys can come back. You might have some more updates that you want to talk. You are always welcome on this show, no matter what. All right, guys? Remember that. If you have some new information, you want to drop bombs on them, just let me know. All right.
Sounds good.
Thank you.
All right. Just give me 1 minute. All right. So, guys, thank you guys for watching the show. I hope you got some information. I hope it cleared some stuff up. If you're on the fence, either way, I hope this helped you decide on what you want to do. If you haven't gotten vaccinated, if you had some questions that didn't get answered, I'm sorry. There's only one person here, and they can go through the questions and answer them. So with that said, let me end you with my quote. He who has health has hope, and he who has hope has everything. So again, guys, thank you guys for watching. Appreciate you, and I'll see you next week. Hopefully Brooklyn Pete will be with us. Have a good night. Stay safe.